Hello students, myself Professor P.B. Sargade and we were studying common human diseases, and in that today we are going to discuss about three diseases: Ascariasis, Filariasis and Typhoid. First, the Ascariasis. Ascariasis is an infectious disease of human intestinal tract caused by roundworm Ascaris lumbricoides. The Ascaris lumbricoides is an endoparasite roundworm or nematode. The signs and symptoms of Ascariasis: gastrointestinal discomfort accompanied with vomiting and fever. The second symptom is presence of live worms in the fecal matter. The third symptom or sign is pulmonary disorders occurring in some patients, and the pneumonitis, that is inflammation in the alveolar wall. This is in extreme cases. Next is loss of appetite and loss of weight. The eosinophilia is also seen, that is the number of eosinophils is increased in this case. Next, mode of transmission: food and drinks contaminated with the eggs of these worms is the main mode of transmission. The eggs hatch inside the intestine of the new host when they enters in the new host. The larvae pass through various organs and settle as adults in the digestive system of that particular human being. Now, what are the diagnostic features, the mode of diagnosis and treatment? The diagnosis can be done by microscopic examination of the stool, and the treatment is and use of antihelminthic drugs like piperazine, mebendazole, levamisole, pyrantel. They are effective against the Ascaris lumbricoides. Now, this is the life cycle of Ascaris lumbricoides. In this life cycle, you are able to see the different developmental stages and mode of transmission of Ascaris lumbricoides in the body of human being. What happens here? The infective larva which develops within the eggs, it goes mixed with the food and that food gets contaminated. Then it is swallowed by the human being and it goes in the intestine. Here the digested food which is in the intestine, the larva enters in the bloodstream, it reaches to the heart, it reaches to the lung, it reaches to the trachea and to the pharynx, to the esophagus. Here the adult worms in the intestine, they develop themselves and they give rise to eggs, fertilized eggs, and these fertilized eggs again go into the feces or the fecal matter, and it is again shed when the defecation is done on the open ground in the open spaces. It got mixed with the soil and the mode of infection goes in the cyclic manner, and this is the life cycle of Ascaris lumbricoides. Now, the prevention and control of Ascariasis: avoiding defecation in open spaces prevents the spread of Ascaris. Personal hygiene habits like washing hands with water and soap after using toilet are also important. Washing vegetables thoroughly before cooking and avoiding raw vegetables is important for prevention of Ascariasis. Now, Ascariasis is the infection, and it shows the signs and symptoms we discussed earlier. It is diagnosed, the various drugs they are used to control the Ascaris, and the preventive and control measures are in front of you. Next, we discuss about the next disease, Filariasis. It is also called as elephantiasis. Elephantiasis. Why it is called as elephantiasis, we will discuss later. Filariasis is caused by thread-like worms, nematodes. These nematode parasites are transported from person to person via mosquito bite. Filariasis can be divided into three subtypes as 1. Lymphatic filariasis, 2. Subcutaneous filariasis. Example is Loa loa and Manzanella species. And third, serous. It means abdominal cavity filariasis, and the example is Manzanella species. Lymphatic filariasis is also called as elephantiasis. It is caused by the worms Wuchereria bancrofti, Brugia malai, and Brugia timori. Now, what are the signs and symptoms of filariasis? It shows edema with thickening of skin and underlying tissues. Wuchereria bancrofti affects the legs, arms, breasts, scrotum, etc. In lymphatic filariasis, worms infect lymphatic system and causes enlargement of lymph vessels and nodes. This is elephantiasis, that is, limbs are swollen like legs of elephant. So the term elephantiasis is used. Lymphedema, that is accumulation of lymph fluid in tissue causing swelling. And hydrocele, where testes are enlarged due to accumulation of lymphatic fluid in the testes. Next, here we will discuss about the mode of transmission, and before going to see the mode of transmission, we are now going to see the diagrammatic representation here, mode of transmission of filariasis by the Wuchereria bancrofti. What happens here? This Wuchereria bancrofti needs two hosts and two stages. The one stage is completed in the human body and the another stage is completed in the mosquito body. What happens here in this stage? Firstly, the mosquito takes a blood meal where L3 larva enters the skin of the healthy human being. That means this L3 larva is present inside the body of mosquito, and when this mosquito bites the human being, healthy human being, the larva enters the skin of the human body. This is the infective stage, and in second stage adults are formed in the lymphatics, and next the adults produce sheathed microfilariae that migrate into lymph and blood channels. Next, at the diagnostic stage, the larva shows its development, and next mosquito takes a blood meal. Again, the mosquito bites to that person and takes a blood meal and ingests microfilariae stage, and this, after ingestion by the mosquito, this microfilariae penetrate mosquito's midgut and migrate to thoracic muscles. Now the larva formed is termed as L1 larvae, and after two moldings the L3 larvae is formed and it migrates to head and mosquitoes proboscis. And again, when this mosquito bites a healthy person, again it is transmitted into the human body, healthy human body. So these two stages, first in the human body and second in the mosquito body, is seen. Mode of transmission, we can see here. What happens here? Wuchereria bancrofti is transmitted to human body by female Culex mosquito. It is important to know that the mosquito here is female Culex mosquito. The larvae escape mosquito body and arrive on the human skin as discussed earlier. They penetrate the skin, undergo two moldings before they become adults and settle in the lymphatic system. The incubation period can be as long as 8 to 16 months. Diagnosis and treatment of filariasis. Use of diethyl carbamazine citrate twice a day for 3 weeks and thereafter for 5 days every 6 months is effective against filarial worms. Prevention and control. What are the prevention and control measures? Avoid mosquito bite by using mosquito nets and insect repellents. And the eradication of mosquitoes is essential for the control of filariasis. Now these are the prevention and control measures of the filariasis or elephantiasis. Is typhoid. Typhoid is an acute infection of intestine and it is caused by Salmonella typhi. It is a gram-negative bacteria found in intestinal lumen of infected person. Pathogenicity is due to O antigen, a lipopolysaccharide, it means LPS, present on surface coat of this typhoid. Flagella contains H antigen. Now the antigens, they are present on the Salmonella typhi's body. Now the signs and symptoms of the typhoid are prolonged fever as high as 104 degree Fahrenheit, the general nausea, fatigue and headache, abdominal pain, constipation or diarrhea. Rose colored rash is seen on the skin and white coat on tongue and the patient shows cough. Anorexia, that is loss of appetite. In patients with typhoid, the anorexia, that is loss of appetite, is also seen, and if not treated at the time, it causes breathlessness and irregular heartbeats and sometimes hemorrhage. Now mode of transmission. Now you are able to see the Salmonella typhi on your screen. It is a food and waterborne disease. The insects like housefly and cockroaches feeding on fecal matter may transfer the bacteria to food material. All of you know that housefly and cockroaches, they contaminate the food material, they visit the fecal matter, they visit the food material if it is not properly taken care of, and it causes the infection. The poor hygiene habits and poor sanitation conditions are also responsible for the spread of typhoid. Now, when you see the structure of Salmonella typhi, you are able to see capsule. It is nothing but K antigen or V1 in VI in Salmonella. Inside it, somatic O antigen or cell wall antigen, and there are flagella, they are nothing but H antigen. Now the diagnosis and treatment of typhoid. The Vidal test is used for diagnosis of typhoid. The treatment of typhoid involves surgical removal of gallbladder in severe cases. Now remember, this practice is occurred in severe cases. It is not a common practice. Use of antibiotics like chloromycetin is also helpful in this treatment. And for the prevention of typhoid, WHO, that means World Health Organization, recommends two vaccines as oral: TY20A vaccine and injectable vaccine. It is called as typhoid polysaccharide vaccine. It is sold as Typhim 6 and Typhorix. These vaccines they are used for the treatment of typhoid. Here we conclude study of three diseases: Ascariasis, Filariasis or elephantiasis, and typhoid. Now I think that all of you understood it very clearly. Thank you.